Hi, this is Dr. Nemechek of the Nemechek Protocol in Buckeye, Arizona. Want to talk to you on our second video about how to determine or how to figure out why your child doesn't seem to be getting better. In the first video, I talked about that the overall issue I look at, it's not going to be your olive oil, it's not going to be your fish oil. The number one thing I try to determine is the child's gut bacteria balanced, and that's the primary thing to start to see improvement. Not maybe everything, okay, but to start to see improvement. And then there's some issues there where parents are looking at the wrong thing. We talked about socialization or when speech should come and things like that. There's also, on a lesser degree, in short term, you could have sinus infections and some intervening things that'll slow progression, but those are usually only last for a couple weeks and it wouldn't be a long-term issue. What we're talking about here are things that really after several months, it seems like there's no progression, and what do you do? So in looking at that, in the gut balance, this video is going to focus mainly on inulin, all right? So inulin, or as I like to call it, bird food, tends to work real well in younger kids. Once you get up to 10 to 20 year age bracket, it starts to not work. But earlier this week, I had a 11 and a 14-year-old brothers doing great on inulin. So it's not like it stops in everybody, but it's just a general trend, and it generally is not effective for brain recovery in people over 20. So that's kind of my general rule for inulin. Now, there's a couple issues with inulin. One, the majority of kids, it works great. All right, so people on the internet, and I don't mean this as criticism, but it's just a natural thing. When you're having problems, you tend to reach out more. And so if you're listening, it sounds like, boy, everybody has trouble with inulin. And I really don't think that's the case at all. I think the majority of the kids do just fine with these lowish doses. And once you start the inulin, your kid kind of has the awakening. Okay, now just as a reminder, as you get older, it's not so obvious, the awakening. It's more like an awareness where they're really just paying attention more. They can hear you more. They respond a little more quickly. Okay, but so once you have that, and the kids generally, if the inulin is successful, boom, tons of things start getting better. All right, now not maybe everything, and for the things that lag behind, that's when you need a vagus stimulator, and we'll talk about that later. But you want to see a lot of things getting better, okay? And that's, I think, probably the most common thing that a lot of parents will experience. Now, there's a small number of parents where the kids seem to be very intolerant to it, just even at tiny doses. What's happening, it seems, and I don't fully understand the mechanism, but the kids are behaving as if they're getting a drop in blood pressure through their autonomic nervous system. And the bacteria in your small intestine can directly communicate with the autonomic nervous system. So I've had parents where at 1/32nd, 1/16th of a teaspoon, these tiny doses, the kids become much more physically hyper, anxious, they're really hungry, they can't sleep. This grouping of symptoms are classic symptoms in the autonomic nervous system of when the blood pressure in the brain is a little too low and the brain is getting not enough oxygen, and it makes the brain kind of anxious, and you do all this kind of stuff. So there's a small group of parents where that low dose of inulin, you just can't even get started, and you got to stop. If that happens, you just move on to rifaximin, okay, even at a young age. You just got to move on and be done with it. Why are they intolerant? We just don't know. I mean, that's really the honest answer. But you just accept it. You move on to rifaximin. I've done this many times, and the kids will do well after rifaximin. Now, more commonly is you'll start on inulin, and you're trucking along, and things are going really good. You're 6 months in, 12 months in, and then suddenly everything seems to come to a halt. There's no more progress. There may be a little backsliding in how the child's behaving, and this is just simple inulin failure. It's going to quit working at some time. We know up in the teens it won't work. So somewhere between 3, when you maybe start, and 13, there's a good chance the inulin is just going to quit working. Now, the reason for this is not quite clear, but we do know that when a child's born, up until around the age 20, there is a natural kind of change in the bacteria in both the small intestine and the colon. It's a normal, natural, healthy process that happens. And then generally from 20 to about 70, our bacteria stays the same. And then from 70 on, as we start aging, it starts changing again. So that's kind of the basic plan here in how nature changes our gut bacteria. And I think, if you start at 3 years old and you have a couple years of inulin and things are trucking along, and at 7, it just seems to quit working, I think it's just a manifestation of some of this natural kind of progression of our gut bacteria, and you've moved on to the realm where the bacteria involved in the overgrowth phenomena no longer are controlled by inulin. Okay, so I don't view it as oh my gosh, this is a bad sign or anything like that. I just view it as part of the normal process. Okay, so you start your kid on, you got fish oil and olive oil, doses are in the ballpark. Don't adjust the fish oil and olive oil much. Okay, that's not where the problem's going to be. It's going to be in balancing the gut. Either, it's super intolerant in a few cases, then you have to just move on to rifaximin, or it works and you're seeing a whole bunch of improvement and things are going along and you're doing really well. And then it could be 6 months in, it could be 6 years in. And then what's going to happen is suddenly things come to a standstill. Okay, it's not that the whole thing, you plateaued and nothing else is going to get better. It's all about the gut bacteria. And what you're going to need to do at that time, and we call it inulin failure, you get rid of the inulin, you treat them with rifaximin, and then when you're done with that 10-day course of rifaximin, I don't ever start the inulin back. Okay, it's harmless, I think, if you do, other than maybe if you give them too much, they're a little gassy or something. I don't think it's going to cause a problem if you want to do that. But I want to just keep the steps in the day and everything to a minimum. We don't think it's going to work anymore because you've had that kind of natural just change in bacteria, and it's not good enough. Okay, and so that's pretty much it. On the inulin side, it either works great for many months or many years, or you're going to have some intolerance, and then once you hit those 2 points, you just stop the inulin and you move on to rifaximin. All right, that's Dr. Nemechek, the Nemechek protocol from Buckeye, Arizona. Everybody have a wonderful day. Take care now. Bye.